let's get started. Thoracic duct. Thoracic duct is the largest lymphatic vessel that drains the lymph from most of the body into the bloodstream. The lymph in the thoracic duct is milky white in appearance because it contains a product of fat digestion. The duct appears beaded, as you can see in the diagram, due to the presence of numerous valvae in its lumen. Area of drainage. The thoracic duct drains the lymph from all the parts of the body except, you can see in the diagram, except right side of head and neck, right side of chest wall, right side of lung, right side of heart, right surface of liver, and right upper limb. Thoracic duct extends from cisterna chyli, that is at T12 vertebra, to the junction of left internal jugular vein and left subclavian vein. It terminates here. It's almost 45 cm in length and 0.5 cm in width. The duct begins in the abdomen at the lower border of T12 vertebra. As a continuation of cisterna chyli, it enters thorax at the aortic hiatus along with descending aorta and azygous vein. There will be an aortic hiatus in the diaphragm through which descending aorta will goes down along with this thoracic duct, and the azygous vein also pass through the diaphragm. It ascends in the posterior mediastinum. It will be in the posterior mediastinum, and then it ascends into the superior mediastinum. Superior mediastinum at the level of sternal angle and T4 vertebra, an imaginary line that divides superior mediastinum and inferior mediastinum. You can see that in another video where I will explain complete mediastinum. It crosses the midline at the T5 from right side to left and enters into superior mediastinum. And here it ascends along the left border of esophagus and terminates in the junction of left internal jugular vein and left subclavian vein. Now we will study relation of thoracic duct at aortic hiatus. It is cisterna chyli, T12 vertebra, descending thorax, aorta, descending thoracic aorta. It's thoracic duct at the level of T12, that's aortic hiatus. Anteriorly there will be diaphragm, median or quet ligament of diaphragm, and posterior it is, as seen in the diagram, T12 vertebra, and towards the right side it is azygous vein. Azygous vein, it is same continuation of azygous vein. It is azygous vein here, and T12 vertebra back side, posterior T12 vertebra, right side azygous vein, and left side as seen descending thoracic aorta. It is at T12 vertebra, that is aortic hiatus, in the posterior mediastinum. Anterior will be again diaphragm, and posterior will be vertebral column and anterior longitudinal ligament and right posterior intercostal arteries. Towards the right again same azygous vein, and left descending thoracic aorta. You can see this in diagram here. In the superior mediastinum, anterior that will be arch of aorta, posterior vertebral column, and towards the right this is edge of esophagus, and towards left here will be a left lung and pleura that covers lung here, and in the neck, root of the neck, that is at almost C7 level. Anterior there will be a carotid sheath containing left common carotid artery and left internal jugular vein, and also a left vagus nerve. And posterior it will be a vertebral artery and vertebral vein, scalenus anterior muscle, and phrenic nerve. Now we'll study about branches that are tributaries of thoracic duct. First we'll name them. Right bronchomediastinal trunk. This is right subclavian trunk, right jugular trunk, right lymphatic trunk, that's main one, left jugular trunk, left subclavian trunk, left bronchomediastinal trunk. This is thoracic duct. So descending thoracic lymph trunk, it's cisterna chyli. Ascending thoracic lymph trunk, iliac lymph trunks. These are the branches. Once again we'll study. Left jugular lymph trunk, left subclavian lymph trunk, left bronchomediastinal lymph trunk. Here right lymphatic trunk, right jugular trunk, right subclavian trunk, right bronchomediastinal trunk. Descending thoracic lymph trunk, ascending thoracic lymph trunk, and iliac lymph trunks. These are the branches of lymphatic duct. And clinical importance: if this lymphatic duct get injured during surgery, it may lead to chylothorax, because this thoracic duct contains a product of fat digestion, that is chyl. If it get injured or it get broke during surgery, that product may come out and get accumulated at that place. It is called chylothorax. So during surgery it has to be taken most care, because it appears like milky white, colorless. So there is a more chances of injury during surgery. Thank you.